Hello everyone, welcome back to Study. Today we are going to discuss about the anatomy of eyelid, which was the part 2 of the anatomy of eyelids, in which we are going to discuss about the layers of the eyelid, right? So we have discussed before that what eyelid is and what are the major functions of eyelid and some anatomical structures related to the eyelid. So today we are going to see that what are the layers that an eyelid consists of. So first layer which the eyelid consists of, or the main layer which you can see from the outside, that is the skin, right? So let's move on. So the skin is the thinnest covering. As you can see that when you touch your eyelid, you can feel that it is the thinnest and very elastic structure, right? So it becomes loose with age. In older patient, that eyelid has become very loose and is not that much elastic, right? So skin of the eyelid has also some small hairs or cilias that are named as eyelashes. So the big one are eyelashes, big eyelashes, which you can see, and you have some of the girls and a lot of girls apply mascara on. That hairs on the eyelid are basically the eyelashes, which are a lot in numbers and are more in upper eyelid, that is about 100 to 150, while okay, so while 50 to 75 in lower eyelid, and they grow, right? So after every 150 days, 100 to 150 days, the eyelashes can grow, and they are the old ones are removed. Like you can see that a lot of time your eyelash break. So the area where a specific eyelash breaks, there is a process that they can regrow, right? Now we have the lid gland. So in the skin we have lid glands as well. So these lid glands are the gland of Zeiss and mole, which are present in the skin, right? So let us see where. So this is basically the skin, right? And over here you can see there are two glands, that is in the skin there are two glands that are gland of Zeiss, and here this is the gland of mole. So basically this is the eye, and from inner to outer we are going to view that what are the layers of the eyelid. So the outermost one was skin, and which was the thinnest and the elastic covering, and has eyelashes. This is an eyelash, right? So there are some lid glands in the skin which are Zeiss and mole glands, right? So we are going to discuss that what Zeiss and gland mole is basically. So the gland of Zeiss are basically the modified sebaceous gland. So sebaceous gland means that they secrete sebum, which is an oily secretion, right? Or it's an oil, or have is a fatty production. So that glands that produce sebum or an oily secretions, they are the sebaceous gland, and they are attached to the hair follicle. So basically they are attached to eyelash inside the skin, right? So over here you can see this was an eyelash, and with the hair follicle, this structure, yellowish structure, is the gland of Zeiss, which produces the oil, right? So which can also be named as sebum, and they are the sebaceous glands, right? So now they pour secretions into the hair follicle. So at the base of the eyelash is the hair follicle, where the gland of Zeiss is attached, and it produces the secretion onto the hair follicle. So this helps in the nourishment of the eyelash as well, so that eyelash may not be dried, as well as it helps in different, that oily secretion helps in the tear film, making of the tear film, right? So this is the sebaceous gland. Now it keeps the lashes healthy and lubricated. So as I have already told you that they are attached to the eyelashes, that is why they keep the eyelashes healthy, so that they may not be dried. So next we have the gland of mole, which is basically the modified sweat gland, right? So they are located near the lid margin. So they also produce some amount of sebum, right? So these both are producing oils, and they will help in the nourishment of the or in the lubrication or keeping the eyelash healthy, and as well as they will contribute a little amount of uh, mole, and these gland will help in the making of the tear film layers, one of the tear film layer, which we will discuss later, right? So they are located near the lid margin. So this was the lid margin over here, this. This is the lid margin, and over here near the lid margin and the hair follicle we have the gland of mole. So while you will see the margins of the upper and lower eyelid, there near near the lid margin we have the gland of mole, and on the hair follicle or on the base of the eyelash we have the these glands, right? Okay, so their ducts opens up into directly into the hair follicle. It can the ducts means that these tubular structure you can see over here, this tubular structure by which the secretions can move out, right? So if the these gland is producing oil, the oil will move from these ducts, these tube like structure, into the hair follicle in order to provide nourishment or to make the eyelashes, or to keep the eyelashes healthy, right? So similarly, the ducts of the this small gland can open directly into the hair follicle. They can open into the eyelid margin as well, or they can just be attached to the ducts of these gland and can produce the same secretions, right? So now the function of the lid gland, what is the function of these both glands? They will produce the oil and they will keep the ocular surface moist by contributing to the layer, which layer? It is a lipid layer of the tear film. So they will keep the eyelashes healthy, they will make the ocular surface moist. So this is the basic function, right? Okay, so next layer after the skin. The skin was the most outermost structure. After the skin, we have the other inner structure, that is the subcutaneous connective tissue layer, which lies just below the skin, and it is made up of connective tissues. So it consists of collagens and elastic fibers and fats, etc. Right? So this layer, the specification or why is this layer important is because it has a lot of fats in it, right? So this is a basically a type of fatty layer. It has fats in it, and the importance of this layer is that it acts as a layer of insulation, right? So it protects the eye and muscle from any kind of changes in the temperature and any kind of shock. So fat, basically, what is the purpose of fat? That it acts as a insulatory layer, right? So fat, whenever there is any fatty layer in any part of a body, it will protect the body from any kind of change in the temperature. What does that mean? If we are in very cold environment, so what will those fat do? That they will help the body to maintain the temperature, or this change in the temperature, if it fats will make the body heat up, right? So wherever is fat, they will help in as an insulation, as a layer of insulation that will not only protect the body from any kind of change in the temperature, but also from any kind of shock. So in the eye, what is the importance of this layer is that this layer protects the eye as well as the muscles, so that no shock or change in temperature can affect or harm the eye, right? So the basically eyelid was made for the protection of the eye, so that because we know the eye is very important structure, so in order to protect it from any kind of harm, the eyelid was created, the eyelid. So if the eyelids are there, what is its purpose? That every single layer in the eye, eyelids will protect the eye and have some specific function, right? So as we have discussed about the skin purpose was that it was the outermost layer, and it has some glands in it which were giving the production, which were keeping the ocular surface moist, and along with it, it was keeping the eyelashes healthy, right? Now subcutaneous connective tissue function is that it helps as an insulatory layer, so it will protect from any change of environment and any shock that comes to the or that can affect or that can harm to eye or any ocular muscle, right? Okay, so next we have the orbicularis oculi muscle, which is the most important muscle of the eye that helps in the closure of the eye. So what does it mean? That when you are closing your eyes, basically you are closing your eyelids, right? So when you are closing your eyelid, the muscle that is helping your eyelids to close the eye is basically the orbicularis oculi muscle, and it is a skeletal striated muscle, means that it has lines or striations on it and is an elliptical in shape, right? So if you are observing the oculi muscle from the front, you can see that it is arranged in a circular manner surrounding the eye around the aperture, which aperture? Palpebral aperture. In the last video we have discussed about the palpebral aperture, that it is a space between the eyelids, upper and lower eyelid. So opening between the upper and lower eyelid was the palpebral aperture, and the ocular muscle surrounds this aperture in a circular manner in order to close the eyelids. So here you can see this is the, so it is arranged in a circular manner along this space, this palpebral aperture, which was the space between upper and lower eyelid, and it has some striations on it. You can see that there are some lines on it, and it is oval in shape as well. So this muscle helps the eye to, in order to close the eye. The only muscle that functions at that time is the orbicularis oculi muscle, right? Okay, so this muscle has two parts. One is the palpebral part, while other one is the orbital part. So the part of the muscle which lies at the region of, or which lie under the eyelid, is the palpebral part of orbicularis muscle, and the part of the muscle that surrounds the eyelid region is the orbital part. So over here I want you all to notice that it is not only surrounding this eyelid region. So basically this is the eyelid region, this one. From here to here is the eyelid region. So this part, which is starting from the lid margin to this part, this region, palpebral sulcus, this is the part that is under the eyelid, or is the part of orbicularis muscle that is surrounding the, uh, that is lying under the um, eyelid. So this is the palpebral part, while the part of the muscle that surrounds the eyelid, this part, right, this one, which is on the orbital, or on the orbit, that one is the orbital part of the orbicularis oculi muscle, right? Okay, so both of these parts has some specific function. So the palpebral part of the oculi muscle that is lying under the eyelid is helping the eye to squeeze. So while you are squeezing your eyes in order to see any object, while you are contracting your eyelids, or you are just making your eye a little small in order to see anything, it means while you are squeezing your eye and while you are winking, right? At that time, which part of the orbital oculi muscle is activated? That is the palpebral part of the oculi muscle. While you are doing the blinking, while I am blinking my eyes, either it is involuntary or either it is voluntary. It means either it is in my control or either it's not in my control, but I am blinking, I am closing my eyes for 0.1 second or for a little time. That blinking is just done by the orbital part of the oculi muscle. So we have, uh, while I'm saying that I am closing my eyes, either the closure is a voluntary or involuntary, that is done by the orbital part. So in closing we have basically three things. One is we are closing the eye while we are doing wink, while we wink. We are closing our eyes while we squeeze our eyes in order to see anything, and we are closing our eyes while we are doing blinking. So at any three functions we are performing is done by the oculi muscle, and it has further two parts which is specific for every function, right? Hope this is clear now. So here I again want to tell you that this region which was under the eyelid, right, that is a palpebral part. The region which is on the orbital part of the orbital region, it is the orbital part. It means that it is surrounding the eyelids. It is the orbital part of the oculi muscle. So uh, overall, this is the orbital orbicularis oculi muscle, which helps in the closure, and it is a muscle that surrounds the, this is the palpebral aperture, so which was a space between upper and lower eyelids, right? So functions we have already discussed, that it helps in blinking, voluntary closure of the eyelids while I am closing my eyes or I am squeezing my eyes, right? And in the drainage of tear, as at this region, in the medial canthus region, we have the puncta, right? That is the path from where the tears can be drained from the eye to the nose, right? So here is the nose. So how that is drained out, or the layer of the tear film is drained out from the eye to the nose, this is done by the help of orbicularis ocular muscle. How? When we will close our eyes, when we close our eyes, what will happen? A pressure will create and it will move the tears up from lateral to medial side, and that blink with that is all done by the orbicularis muscle, that we are closing our eyes because of the orbicularis muscle. So there will be a pressure onto the eye, and the tears will move from lateral side to the medial side, and in the medial side we have the puncta. So while there we are closing our eyes, the pressure that have moved the tears from lateral to medial side will now uh, throw or drain the tears into that hole, and from that hole or from that punctum, the tears will be drained into the nose, and now a new layer has been of tears has been there on the eye. So I hope this is clear that the drainage of tear is also done, or there is some kind of contribution of the orbicularis muscle as well into it, because because of blinking the tears are moving to the medial side, right? Okay, so the nerve supply of orbicularis oculi muscle is by the facial nerve, which is the seventh cranial nerve. So in any case that seventh cranial nerve is affected, orbicularis muscles function can be affected as well, right? Okay, first of all, the outermost layer was the skin, then we have the subcutaneous connective tissues, then third layer was orbicularis oculi muscle. Now fourth layer is the submuscular connective tissue layer, which lies under the orbicularis muscle, and it is the very most important layer because it has the nerve endings in it. What does nerve ending means? That if I was saying that orbicularis oculi muscle was supplied by the seventh nerve, so in this layer, in the submuscular connective tissue layer, the nerves are ending. The nerves of seventh cranial nerve are ending in this structure. So the nerve endings of the nerves which are supplying to our eye, they end in this layer, right? So they end in the submuscular connective tissue. So all those nerve fiber endings of all the nerves that are supplying to the eye, they end at this layer. And when we want to when we are going to do any kind of surgical procedure, in order to make our eye numb, we need to inject anesthesia in this layer so that the eye may not get sensations during the surgical procedures, right? Okay, so the next layer which lies under the submuscular connective tissue is the tarsal plate, which is a tough and thick fibrous structure. It means that it is a hard structure that helps in the maintenance of the shape of eyelid, right? So it was while we are talking about the height of the tarsal plate, in upper eyelid it was 11 millimeter in height in the center, and then it get narrows while we move towards the end. And in lower eyelid it was about, or it is about 5 millimeters, and then it again get narrows as we are moving towards the end, because upper eyelid is a bigger one while lower eyelid is a small one. So that is why the height, the structures are smaller as compared to the upper eyelid, right? So length of the tarsal plate, so each tarsal plate is about 29 millimeter in length. It means that it is 29 millimeters long. While we are talking about the thickness of the tarsal plate, it means that it is 1 millimeter thick. So each tarsal plate is 1 millimeter thick and 29 millimeters long. So what is the importance? So first of all, I have told you that it is a hard structure, so it helps in maintenance of the shape of eyelid. And then we have the modified sebaceous gland, again the gland that produces the sebum oil, the major gland that produces oil that helps in the production of the lipid layer in the tear film is the Meibomian gland. That gland lies in the tarsal plate. So that is why tarsal plate is very important, because it has a major gland in it, that is the Meibomian gland. So let's move and talk about Meibomian gland, but first of all we are going to see what tarsal plate look like, right? So this is the eyelid structure, which is a tarsal plate that was hard or tough structure, and was 29 millimeter in length, means that this is the length, right? So it is 29 millimeters in the length, and the height was about 11 millimeters, which decreases while we move towards the end. And if we will see it from the side, the thickness or how much it is thick is 1 millimeter. This is a superior tarsal plate, while this is the inferior tarsal plate, right? This plate helps in making the shape of the eyelid, and it has the sebaceous gland, which is the Meibomian gland. So let's see about Meibomian gland. So the Meibomian gland runs vertically in the tarsal plate. So this was the tarsal plate. So Meibomian glands run vertically, right? So each gland has the central canal, right? So there is a central canal and numerous round appendages that secrete the sebum, which is the oil. Again, I am saying that inside the tarsal plate, the Meibomian glands run. And if we are talking about the structure of Meibomian gland, there is a central canal and in the numerous circular structures that produce the oil. So the glands in the upper eyelid are about 30 to 40, and if we are talking about lower eyelid, it is about 20 to 30 in numbers. And the small opening of the canal, they can be seen on the lid margins just on the posterior border. So let's see. So this is the tarsal plate, superior tarsal plate, and this is the here lie the inferior tarsal plate. In each tarsal plate, 30 to 40 Meibomian glands are present, which run vertically, right? So these are running vertically, and what each Meibomian gland consists of, or how they look like, it means that there is a central canal. This is a central canal. Okay, so in each Meibomian gland, this is whole Meibomian gland, and each Meibomian gland has a central canal, and the there are the round structures that are opening in each of the canal. There are all these round appendages. These all round structures open into the central canal. So each gland has a central canal and some round structures. These structures will produce oil, and these will move into the central canal, and later they will be out in order to make the lipid layer of the tear film, and they will also keep the ocular surface moist. So the glands which we have discussed about these and mole, they contribute, right? Major, I have said that they only contribute in the production of the lipid layer of tear film. The major gland that produces the lipid layer is the Meibomian gland, which is in the tarsal plate. So each Meibomian gland has a central canal, and there are some round structures that are producing basically the oil, and they open into this central canal. You can see these small dots, these small opening of the central canal. uh, while you avert your eyelid or just pull your lower eyelid down and place a torch or stand in front of a mirror, or you can see any of your fellow's eye, just pull the lower eyelid, just pull it, pull this lower eyelid. You can see at the posterior border, you can see some dots like structures, and on these, along all lid margin, right? So it's along the whole lid margin, there will be small little dots, which are the opening of the central canal of each Meibomian gland, and you can see some shiny secretions on it. You can see over here these shiny secretions, right? So these shiny secretions are the oily secretions, right? So this is a problematic picture. So while we are discussing only the anatomy, I just want to show that how the canals can appear to you all. You can see these type of shiny appearances on these dots. So these are the oily secretions that are from the Meibomian gland central canal. The function, they secrete the oil, keeps the ocular surface moist by keeping the lipid layer of tear film, which is the tear film is the very important layer of water, oil, and essential things that can make or keep the ocular surface moist. So they prevent the overflow of the tears, because the tears are on the surface of the eye. So they prevent the overflow, means that they keep the tears in touch with the eye, so that they may not they may not flow, they may not cause tearing, and they delay the rapid evaporation of the tears. So as you all know that our eye has some tears in it, it has liquid water in it. So that water helps in the nutrition of the provides the nourishment of the cornea, as well as it provides friction. While we blink, we don't feel difficulty we are feeling in, we are at ease because there is no friction between the eye and eyelid. They don't rub against each other because of the tear layer. And if that tear layer evaporates very soon, we can feel discomfort. So these meibomian glands help in the production of the oil. That oily secretion will help the tears to stay on the eye, and they will help the eye to evaporate less, or they will decrease the evaporation procedure of the tears in order to keep the eye moist, right? So while we were discussing about the tarsal plate, the upper border of the tarsal plate is attached to the orbital margin. So we all know that the eye is inside an orbital region. So this tarsal plate which we were discussing over here, yeah, this tarsal plate is attached to the orbital margin. Over here in the orbit, they are attached at some particular site, right? These Okay. So basically, the orbit has a layer on it. The orbital region or the orbit has a membrane on it, which is the periosteum, right? So any thin layer on the orbit has a thin membrane on it, which is the periosteum. And the orbital septum is basically the extension of the periosteum, right? It means that the orbit has some membrane on it, right, which is the periosteum. It is a covering of the orbit, right, which is the bony structure. And the tarsal plate is attached to this bone membrane, to this orbital membrane part, which is the basically orbital septum, and is, in simple words, is the extension of the periosteum. So arcus marginalis is basically the thickening of margin of periosteum, is the arcus marginalis, where the orbital septum is attached. From there it travels towards the tarsal plate. So I'll explain this over here in this. Okay, so you can see that this is the orbit, right? This and this blackish structure is the orbit. Overall, this is the bony structure. So the tarsal plate, this tarsal plate is attached to the orbital margin, right? So how is this tarsal plate is attached to the orbit? It is by the membrane, which is the orbital septum, which is the extension of the covering of orbit, which was periosteum. So it means that there is a membrane on the orbit which extends and moves towards the tarsal plate, right? So this is a tarsal plate, and this extension of the periosteum membrane is the orbital septum that connects the orbit and the tarsal plate. And later over here, this at this part, the thickening of the periosteum, by which the here you can see this blackish area. This is a thickening of the periosteum membrane, the part where they both are orbital septum and orbit is attached, right? So this is the arcus marginalis. Again, I hope this is clear. This is a structure. Again, I am saying that at the orbital margins, this is the orbital margin. So this is an orbital region. At orbital margin, there is a thickening of the membrane, which is the periosteum, or the covering of the orbit, right, is the membrane of the orbit. So the thickening is the arcus marginalis, and there is again a membrane that extends from this arcus marginalis and moves until the tarsal plate, or move till the tarsal plate, upper and lower both. So this is the orbital septum that connects the tarsal plate and the orbital margins, and this is the orbital septum. I hope this is clear now. So it separates the eyelid from the orbit. So here you can see that from the orbital region it is extending to the eyelid, right? So and above all, this orbital septum is all the other layers of the eyelid. So it is separating the eyelids from the orbit. So this is the orbit or a bony structure, right? This orbital septum is separating the eyelid structures from the orbit, right? Okay, so this acts as a barrier and prevents infection, inflammation, bloods from spilling to the orbit. So it means that this layer is very helpful when any of the damage to the eyelid has been caused, what will it do? That it will not allow the inflammation, blood, or any other foreign particle to move towards the orbit, right? So that is why this orbital septum plays a very important role, because it separates the eyelid region from the orbit. And if there is any kind of infection in the eyelid, it can not allow that infection to pass or to go further into the inner layer of the eye, or to move into the orbital region, because we know that in orbit we have muscles, we have orbital fat, we have nerve, important nerve, that is the optic nerve. So if these all structures are damaged, overall eye can be damaged. So this that is why the orbital septum is very important structure. Okay, so now next layer is the levator palpebral superioris muscle. We have discussed that there is a muscle that helps in the closure of the eye. So what muscle help in the elevation or opening of the eye? So when we are opening, we are talking, our eyes are open. When we are viewing anything or we are seeing anything, our eyes are open. So which muscle helps the eye to open? The muscle that helps the eyelids to elevate, right? Or the eyelids to open is basically the levator palpebrae superioris, which is the LPS muscle, and it lies behind the septum. So it is in the orbit, right? So this is behind the septum. And what is the origin? That it originates at the lesser wing of sphenoid bone at the orbital apex. So orbit is basically a structure that it has a opening. The opening where the eye is present is the base, while it is it is a pyramid shape, right? So it has a base in which the eye is present, and at the back side is the apex, right? Basically these are all bones. These cones are all the bones. So the LPS muscle is originating from the back side at the orbital apex, at the lesser wing of sphenoid bone, and it travels horizontally. It is traveling horizontally along the roof. So it is moving along the roof of the orbit, and then it fans out, or it extends, or it spreads onto the eyelid, so that the eye may open, or eyelids may open. So LPS is narrow at its origin, and then the muscle spreads and become broad. It means that it was narrow when it was originating at the apex of the orbit, but then while it comes to the as it comes to the eyelid, towards the eyelid, because we all know that our eyelids are broad. So in order to cover that eyelid region, so that it can help the eyelids to open, it then spreads and broadens out, right? So LPS muscle pierces the orbital septum and inserts into the superior tarsal plate. So the very important thing is that orbital septum at some point in the orbital septum, LP, because we have said that LPS lies beneath or below the um, septum. So that is why it pierces the orbital septum, so that it can go to the eyelids, right? So it get attached into the superior tarsal plate, then it move forward and pierces the orbicularis oculi and get attached to the skin. So the because it has to go to the skin in order to move, or in order to help the eyelids to open completely, what it do is that it pierces all the structures that come in its way. So as it lies under the, or it is lying below the orbital septum, so all the layers that are lying above the orbital septum, it will pierce these structures. So and then it gets attached to the skin. So this pull of LPS on the skin of eyelid leads to the formation of upper lid crease. So the function of the LPS muscle is to raise the eyelids, and the nerve supply of LPS muscle is by the third cranial nerve, which is the ocular motor nerve, right? So any damage to the oculomotor nerve can affect the LPS muscle's function, right? So here you can see that this was the orbicularis oculi muscle. So LPS muscle pierces all the previous structure, and then it gets attached to the superior tarsal plate in order to raise the eyelids, right? And here you can see, over here there comes a pull at this structure. You can see a lot of time while you open, there is a fold in your skin, and I have discussed in the previous lecture in the part 1 of the anatomy of eyelid that the lid crease is basically a hollow space. So how this hollowness is created? Because there is a pull on the skin. So this pull that makes the okay, so this pull is creating the making the upper lid crease, right? So same is the case with the lower lid crease as well. So now we have the other structure, which is the conjunctiva, which you can see while you avert your eyelids. So when you are averting your eyelids, you see a pinkish structure. That is basically the innermost structure of the eyelid, and the last structure of the eyelid, that is the conjunctiva, which is a thin, transparent, and vascularized membrane that is firmly attached to the tarsal plate. So basically, this pinkish structure is the tarsal plate, and on this tarsal plate, on this pinkish structure, we have a thin and transparent membrane which has the blood vessels in it. This is the conjunctiva. So this conjunctiva is not only present under the eyelid but is also present on the whitish structure of the eyeball. So on the eyeball, when you see some redness on the whitish structure, that is basically the blood vessels of the conjunctiva that makes the whitish structure red for some time when you see redness in your eyes, right? So now this thin transparent structure is very tightly attached to the tarsal plate, and it is very difficult to separate these both layers, right? So the part of conjunctiva which was basically present at the lids is the palpebral conjunctiva. So I have said that there is a layer that is present on the whitish sclera of the eyeball, that is of conjunctiva, which is the bulbar. But now we are talking about right now we are talking about the palpebral conjunctiva, which is the structure that is attached to the tarsal plate, or which is attached to the eyelids. When we avert our eyelids, we see that pinkish structure. On that pinkish structure, we have the transparent vascularized structure which has blood vessels in it. This is the palpebral conjunctiva. So what is the importance of this conjunctiva? So this conjunctival layer has some goblet cells in it that secrete the mucin layer of tear film. It also contains this conjunctiva. Right now the important thing is accessory lacrimal glands, right? Okay, so the importance is that it has goblet cells and accessory lacrimal glands in it, right? So what are over here? This, when I was talking about when you will avert your eyelid, you can see the pinkish structure, and on that pinkish structure we have the transparent layer, which is the palpebral conjunctiva, which is lying just under the eyelids, right? So this is the palpebral conjunctiva, but this structure, this the structure that we can see on the white part is basically the bulbar conjunctiva. So now, accessory lacrimal glands. There are two accessory lacrimal glands. As we have discussed about, there are glands of Zeiss and Mole that are contributing in the production of oil, which means that they are helping Meibomian glands by secreting oily secretions. So similarly, we have the accessory lacrimal gland that produce basal tears, or they produce the tears, watery layer. They produce waters or tears. Two type of glands: glands of Wolfram and gland of Cross. So they are present along the upper tarsal plate and inferior border of lower tarsal plate. Basically, what you need to know is that the gland of Wolfram are present on the or present on upper and lower tarsal plates, and gland of Cross are present at the fornix. Now, what is fornix? Here. Okay, let's see back where you can understand. This is the palpebral conjunctiva, the layer, this pinkish structure which is lying under the eyelid. And the pinkish structure which is on the white is the bulbar conjunctiva. And this fold, where the palpebral and bulbar conjunctiva are meeting, is the fornix. Now, the gland of Wolfram are present on the tarsal plate, on this palpebral conjunctiva, right, is the gland of Wolfram. But the gland of Cross are present over here at the fornix, at this junction, at this point where both of the conjunctivas meet. So here are the gland of Cross, while gland of Wolfram are on the conjunctiva which is under the eyelid. Okay. So what is the function? They produce the basal tears. So basal tears are those tears that help in the nourishment of the cornea. Here you can see the gland of Wolfram. They are on the conjunctiva, and the gland of Cross are on the at the fornix. and goblet cells are also on the conjunctiva. So now, what is the blood supply of the eyelid? So eyelid is supplied by ophthalmic and lacrimal arteries. So lacrimal artery and ophthalmic artery helps in the blood supply of the eyelids, and the venous drainage is through the ophthalmic vein. So ophthalmic artery supplies blood to the eye, and the blood is then taken away by the ophthalmic vein. This is all about the complete anatomy of the eyelid. In this video, we have discussed about the layers of the eyelid. I hope the lecture is very clear to you. In case of any query, you can comment in comment section. Thank you so much.